everyone, my name is Victoria and I work in the patient support team. So I'm here to answer any admin questions that you may have. We have the first question in, actually it's from Francesca, and it says, how do I pay? Just to let you know that we do require payment for your procedure 7 days before your procedure date. Now, there are a couple of options for how you can pay that. Both involve phoning in and the number will be below. But just to let you know that we can process your payment via card transaction over the phone, or we can provide you with our bank details and you can arrange a bank transfer. Okay, so we've got another question here, all from Anne. I've been given a pre-op assessment appointment. I cannot attend. What do I do? And this does happen quite often, actually. But just to let you know that the hospitals actually organise these appointments directly. So what you would need to do is you would need to call the hospital, and they will rearrange where they can. They will do their best to try and meet your requirements. A question here from Sarah. So what time should I arrive at the hospital? You will be informed, Sarah, in a matter of 2 ways. The first is via letter, and this will come directly from the hospital. The letter will include your admission time and your fasting instructions. So just make sure you arrive at the hospital sort of 15 minutes before your admission time, just so you're not rushing. Or alternatively, you will receive a call from one of our nursing team, and they will again confirm your admission and fasting instructions. And if for whatever reason we can't get hold of you on the phone, we will drop you an email, but we will keep trying you. So a message here from Erica. How far in advance do I have to book appointments? Now, with regards to band adjustment appointments, 4 weeks in advance is preferable. And that's just to allow us to be able to accommodate you and to get you in the diary in enough time. Now, just to remind you, or you may not be aware, for your first band adjustment, we do have to wait a minimum of 5 weeks post-op to arrange your appointment. Now, this is arranged slightly differently because it is usually organised by one of the nurses on your post-op call. However, please be aware that you can give us a call and we can book this in if you'd rather do it before that call. I hope that makes sense. Okay, so we've got a question here from Louise. What support can I expect long term? Well, this is a really good question, Louise. Initially, you will receive your post-op calls from one of the medical teams, so one of our lovely nurses will be giving you a call. The support calls then get passed on to the patient support team, so you might actually get a call from me, and I usually ask how you're doing, catching up with you, checking if you've got any queries or if you're worried about anything, and also for you to share your successes as well, because it's just so lovely to hear and support you along your journey. But just to remind everybody, we are here to answer your queries or questions, so please know that you are welcome to call us at any time. Another message here from Sam. What paperwork do I have to complete? Now, there are a couple of sets of paperwork, Sam, that will be sent to you. The one from Healthier Weight will be sent in an email, and there are step-by-step instructions provided, so hopefully you'll feel confident completing those. But please be aware again, if you do need to give us a call, if you're stuck or you're unsure of anything, then please do call us so we can talk you through step by step if needed. But also you will receive a pack from the hospital, and there's some paperwork in there that they also like you to complete and return before your procedure date. Now, it is imperative that we receive your signed documents before your procedure can take place. Question here from Jason. So, do I have to tell my GP? Well, the answer is no, you don't have to. However, we do stress that it is in your best interest to make your GP aware of all your treatments and all the procedures or procedure you're going to receive. Your GP does hold the right to refuse any advice with regards to your procedure, and this does include emergency treatment as well. So unless you really don't want your GP to know, we would strongly advise you to let us contact them. Now, all that involves is a letter preoperatively, letting them know that you are going to have a procedure, and it's just a standard letter. And then after your procedure, we send out almost like a discharge letter, just so they know that you've had your procedure and where it took place. The message here from John. John's, I don't want anyone to know about my surgery. How will you maintain my privacy? John, just to let you know, and to everybody else, we have to adhere to the Data Protection Act. Now, that means we will only speak to you about your procedure, so please be rest assured that we wouldn't speak to anybody else. However, on the flip side of that, we can speak to third parties, but we always obtain authorization from you before doing that. So sometimes we get situations where parents like to be involved, so we have the mother's name, for instance, but again, that is entirely your decision. And also, just for a little bit more reassurance, when we are trying to contact you, and for instance, if we're leaving a voicemail message for you, we never disclose the full name of our company. We tend to use in the patient support team HWC, so nobody else would be aware of who we are if they do interpret your messages. She's written in and she's asked, I've heard that you offer a Facebook forum. What is this? Now, the Facebook forum is available for all of our patients, so they have full access to it. And it is a private, secret group just for patients that have had procedures. Now, it's such a good network and such great support. It's lovely for patients to be able to share their experiences. We see lots of tips, motivation. We have patients that have inspiring photographs, so they'll put the before and after photos on there. So it is a really lovely method of keeping in touch with fellow patients. And you just then won't feel alone, and that you won't feel that it's just you that's gone through this. So it's just a great network there. So we've got a question here from Hayley. What's included in the aftercare? Now, with regards to the aftercare, you do have 2 years. Now, this is dated from your procedure date. Sorry, so you get 2 years aftercare. That includes review appointments, telephone support, also access to the emergency helpline. And also, it's just lovely to know that you can give our nursing team a call. So you get support from the bariatric nursing team on the telephone. And also, just in addition to that, if you are a lap band patient, you receive 2 years of free band adjustment appointments. Now, that includes tightening adjustment appointments and also aspirations, which means a slight defill or a defill of your band. Now, with regards to bypass and sleeve patients, that's a little bit different. They get obviously the review appointments as well, but also a 6-month blood test, and that's just to check that everything's okay following their procedure. So, a message here from Rachel. How do I book an appointment? Now, to book an appointment, if it's a band adjustment appointment or a review, you give us a call on the patient support team, the landline number, that's going to be shown below as I previously mentioned. So it is better for you to give us a call so that we can go through the diaries and book you an appointment with an appropriate time for you and date. And then just to let you know that this appointment is confirmed by an email, and in the email it will include confirmation of the time. It will also confirm a map of where you've got to go and the date as well. We've just got another message here from Francesca. Can I contact you at any time, evenings and weekends too? Okay, just to let you know that the office hours are 9 o'clock until 5 o'clock Monday to Friday. Now, we do have an out of hours emergency number if it's necessary. Now, this is available from 7 in the morning, so 7 a.m. until 10 p.m. every day. So if you do feel that you do need to speak to somebody in an emergency situation, then you'd call that number. Now, if you call the number and outside of these hours, so before 7 and after 10, you will be directed to our website, and it will send you to our emergency section on the website with some instructions to follow. Just to let you know again that both our main telephone number and our emergency contact number will be shown below, so hopefully you will have everything you need in preparation, okay? So, you just see that we're coming to the end of our session, so just wondering if there are any other questions? So, I don't think there's any through. So I just wanted to say thank you all for watching, and thank you for your questions. And if you do have any queries, like I said before, please do give us a call on 0121 693 4488. Thanks again.